That's great. Dealing with people with physical limitations, and then some of them on top of that are dealing with the cognitive issues like a dementia diagnosis. Families face uncertainty sometimes at any given time of day or night, but especially for people dealing with dementia and facing sundown syndrome. What do you recommend they do if like at bedtime they're wanting them to get their teeth brushed so they have that good hygiene, and they're dealing with sundowning? What can you do to help get them to brush their teeth during that phase?
I kind of touched on this earlier, following an action with another action, but I will also say too is, giving them a toothbrush, and even though they might not even be bringing it to their mouth,
Yeah.
having them hold a toothbrush, once again, there's a sense of control. There's a sense of they're helping, right? Oh, you're holding a toothbrush, I'm holding a toothbrush too. And then either having, you bringing that toothbrush to their mouth, and then you're doing it with the tell, show, do method, or they're just holding it and now you're brushing their teeth. And honestly, if you've got a night where, it's been like today, it's cloudy, it's rainy, it's dark, right? Sundowning may happen, as early as, 2, 3 o'clock in the afternoon today, right? And then, we have to have dinner. Maybe you're just not able to brush that night. If we can give them a lot of water to be drinking, even if you're using thickeners, if you're at the stage now where you're using thickeners, just trying to get as much down as possible, and then say, hey mom, I'm going to do a quick check in your mouth to make sure there's no food in there. And how to do it without getting bit is, once again, your eye level with them, your knee to knee, you're touching the side of the face. And what I do is that I do this.
Hmm.
I hook my finger around and around. They can clench and grind all they want, but as long as my finger is right on the inside of the cheek, they can't hurt me. So you were talking about earlier of fear of getting bit. That is a perfect way to make sure that you can look straight in the back there to make sure there's no food. And then you can use one of those swabs, or you can even use your other finger. Mom, I'm going to, before you even just start doing it, mom, you've got some food in there. I'm going to try to take that food out. Okay. And then you do it. Tell, show, do. And then you go to the other side. So even if you can't, there is no way you're going to get a toothbrush in the mouth like a day like today, perfectly understandable, but at least check the mouth to make sure there's nothing in there that they can choke. And it can vary day to day, where one day they haven't, there's never been a situation of pocketing food or swirling food. And then all of a sudden, it starts to happen. So it's something that needs to be, oh, my mom doesn't do that. Well, maybe not yet. And she may never. Everyone's different, but it may become a situation where this will start, and this is something that will have to become of your regular routine. If you do start seeing pocketing food, maybe you want to start changing that food. Maybe they don't feel comfortable in swallowing anymore, and so maybe that's a type of food or type of meal that you may have to cross off and not give anymore, to help control that situation. And then, but if it's their favorite food, you do what you can. You do what you can. You compromise, right? But you always still want to be making sure. And even if you're taking food out, and if they're amenable to that, I would still then try again to brush. If you're able to get your hand in there, and maybe you are able, even if it's just side to side and they're done,
Mhm.
I'm okay with that, because at least you've tried, you've gotten that toothbrush in there, you've gotten more junk out, and it's better overall for the mouth.